Hello everyone, I am Dr. Dhiraj Singh, nephrologist working at Grove Healthcare at Nirala in Lucknow. Today I will discuss some salient feature of for peripheral edema. What is edema? Edema is defined as excessive accumulation of fluid in interstitial space. Okay. सामान्य भाषा में हम कहते हैं कि सूजन आ गया है, तो मरीजों को ये समस्या होती है कि कपड़ों का साइज टाइट होने लगता है या पैर में मोजे टाइट होने लगते हैं. तो द मोस्ट कॉमन कॉज ऑफ एडिमा इज either cardiac or renal or liver. So how can we differentiate these three major etiology for edema? If edema is due to cardiac etiology, so it is predominantly started from feet. Then it progresses towards abdomen and face. Along with these swellings, patient also have engorged neck veins. He had a shortness of breath. He may also history of some cardiac disease. He may history of PND and orthopnea. While in case of renal etiology, swelling will start from classically periorbital edema, especially in the morning, and from face it progresses to abdomen and then lower limb. In case of liver, swelling is predominantly started from ascites and then progresses to pedal edema. So, in all three category of major etiology of edema, there is a activation of RAS system, that is renin, angiotensin, aldosterone system. In that there is a excessive activation of this system which causes excessive sodium and water retention, resulting in fluid accumulation. So in every case of edema, major treatment is to decrease the volume status of the patient. That we can achieve by the use of diuretics. So we should advise diuretics in appropriate dose depending on the vitals of the patients. Especially spironolactone has a role which slows the or especially act on the RAS system. But aldosterone is a weak diuretic, so we have to add some stronger diuretics like loop diuretics in the form of furosemide or torsemide. In these cases of cardiac and renal, there is a situation of diuretic resistance. So even after giving the adequate dose of diuretics, patient did not have a adequate response. There is a various etiology for diuretic resistance in cardiac patient and renal patient and liver patient. This low response or diuretic resistance may be due to decreased cardiac output, decreased serum albumin, decreased renal blood flow to the nephrons, and also because of increased uremic toxins, the effects protein bindings of albumin to diuretics will decrease. So we have to increase the dose of diuretics. So maximum dose that we can achieve is furosemide dose we can increase to 160 milligram, and is electron dose we can increase to 400 milligram per day. So, even after giving this maximum dose of diuretic and patient have an inadequate response, then we term as a diuretic resistance. So along with diuretics, we should also aware with the side effect of the diuretics like hyponatremia, hypokalemia, hypotension. During the treatment of a diuretic, we should go for regular monitoring of electrolytes. Apart from diuretics, we should focus on the major etiology for the disease. Like in nephrotic syndrome, we have to treat the basic etiology, either minimal change disease or membranous nephropathy. We have to give specific immunosuppressive therapy for that etiology. Thank you.